Hello and a very warm welcome. Thanks for tuning in to this TV9 digital webinar special where we focus on various health issues. This is our segment called Samajhdar Bano Sehat Ke Ishare Samjho, a special initiative that's a CSR initiative. It's powered by USV and Beat Diabetes Win Life. आज दोस्तों हम बात कर रहे हैं एक ऐसे इशू की जो कि सिर्फ एक मेडिकल कंडीशन नहीं बल्कि एक नेशनल कंसर्न बन चुका है. दैट्स राइट. वी आर गोना फोकस ऑन डायबिटीज टुडे. यू थिंक यू नो इनफ, यू थिंक इट्स एज सिंपल एज शुगर एंड स्वीट इनटेक, बट दैट्स नॉट ट्रू. आवर थीम टुडे इज यंग इंडिया, द स्वीट रिस्क, व्हाई डायबिटीज cannot wait, why you should pay more attention to what our expert set of panelists and doctors are soon going to be telling us. Numbers सच में चिंताजनक हैं. भारत में 10 करोड़ लोग ऑलरेडी डायबिटिक हैं और 14 करोड़ और रिस्क पर हैं, प्री डायबिटिक. एंड दीज आर शॉकिंग एंड स्टार्टलिंग फैक्ट्स. इवन स्लिम एंड फिट लुकिंग पीपल, दोज दैट लुक ओके टू गो इन द जिम, can be metabolically unhealthy from the inside. But then again, there's no need to worry because here comes the good news. Diabetes is not a life sentence, how other people might showcase it or tell you. That's not the entire truth. With early detection and smart lifestyle choices, easier said than done, I know, and the right medical guidance, which you will be getting over the course of the next few minutes, you can control it, even beat diabetes. आज हमारे साथ हैं कुछ इंडिया के लीडिंग मेडिकल एक्सपर्ट्स जो मिथ्स को तोड़ने, फैक्ट समझने और आपके सवालों के जवाब देने के लिए ही यहाँ मौजूद हैं ताकि आप अपनी सेहत की जिम्मेदारी खुद ले सकें. Please welcome the incredible panel of medical experts who are here to break myths, answer your questions and help you take charge of your health. Joining us today on the broadcast is Dr. Faraz Farishta, Director of FS Endocrine and Diabetic Centers, Consultant at Care Hospital and Professor at Medicity Institute of Medical Sciences, Hyderabad. Very warm welcome to you, Dr. Farishta. What a beautiful name for a doctor. हर डॉक्टर को फरिश्ता होना चाहिए और सारे फरिश्ते डॉक्टर ही हों, इसी की उम्मीद कर सकते हैं हम. डॉक्टर श्याम सुंदर, CM, Director of Grapes Clinic and Consultant, Endocrinologist and Diabetologist at SS Sparsh Hospital, Bengaluru. Many thanks, Dr. Sundar, for joining us. And Dr. Jeevan Joseph. What a beautiful panel do we have with us. Dr. Sundar, Dr. Jeevan and Dr. Farishta. Dr. Jeevan Joseph, Consultant Endocrinologist and Director, Jeevans Diabetes and Endocrine Center, Vimala Hospital, Etumanur. And before we begin, a quick reminder to everyone that is going to be joining us, to the doctors as well. You're going to be put on the spot. We're going to be taking live questions from people that are joining this webinar. To please switch on your cameras. We'd love to see you and feel free to unmute yourselves. Raise your hands, put your question in the chat box. We'll try to put and direct that across to the doctors as quickly and swiftly as possible. Ask your questions directly to our doctors during this Q&A. This is your session, mind you, your chance to ask, learn and act. Already so many people that are with us. I'm going to again urge all the people to open your camera, show us your beautiful faces and feel free to unmute yourself and ask your questions. I'm going to get the snowball rolling here. All right, Dr. Farishta, let me quickly come to you first. You know, diabetes is no longer just a disease of older people like people would usually have it. I think that's the optics and the perspective out there. In India, many young adults are already developing diabetes because of long working hours, irregular meals, junk food, Swiggy, Blinkit. I don't want to blame or tarnish these applications, but it is easy to get your hands on junk food quicker than you could get your hands on a nice nutritious plate of meal. And then couple that with stress, it's a disaster for recipe. When diabetes starts young, the complications like eyes, kidney, even the heart start appearing earlier. Isn't that the truth? So for the youngsters out there, diabetes cannot actually wait.
Definitely, Kabir. Very well said. And thank you for the invitation. See, definitely we have seen a drastic rise which is happening in young individuals with diabetes. Post-COVID, I think that is where we have analyzed and we have seen that this is a bigger pandemic than what the world has seen. So we are going through a bigger pandemic rather than COVID. We have the diabetes pandemic, especially now we are seeing that in young. And as rightly said, this is because of the lifestyle changes, stress, and then easy to get fast foods. But yes, I would say difficult lifestyle adoption. So definitely a lack of sleep, poor physical activity, inadequate dietary habits, taking all these high carbs, inadequate intake of fruits, good nutritious diet is
Yep.
definitely one of the reasons for this.
But it's so easier to say all of this, no, doctor? Because trust me, the youngster out there, you put this out on a piece of paper, stick it on the fridge, stick it on their notepad, they're not going to follow it until unless they get that red flag and red alert. That's where the checkup comes in. So, do you advise all of the youngsters to go for a health checkup? I mean, should it be once a year? Should it be once every, 3 months? What should be the checking parameters like?
See, if you ask me maybe 2 decades before, we would have said that yes, diabetes would have happened at the age of 35 or 40. But now we are seeing young diabetes. When I say young, we're seeing diabetes at as early as 10 to 15 years as well. So that is early, very early diabetes is what we are seeing. So I think as Asians, we are prone for developing diabetes. So what we have to understand, the gun is already loaded. You need one trigger. So if you have a trigger in the form of family history, obesity, or anybody around your even your friends or families, anybody is having any other comorbidities like hypertension, dyslipidemia, so you should get it checked. So I would say screening as early as probably 15 years or maybe 16 years is where you have to get it checked. And then yearly once, definitely. I mean, and then if you have any symptoms, then you have to follow it up as well.
All right. Let's bring in Dr. Shyam Sundar. Dr. Sundar, I'm now feeling instantly guilty about the ice cream tub I devoured last night before going to bed. But in my opinion, I thought diabetes is for older people. I think we're continuously busting that myth. So what's your opinion? Is diabetes only for older people?
See, at the outset, I thank you for the opportunity. See, that is definitely a myth. Maybe it was true 40 years ago. What I tell to all my patients and during my interaction with the younger colleagues, I tell, see, we see this generational effect. Okay, so if you remember your dada, pardada, okay, they got diabetes after their retirement. Okay, but our parents in their generation, probably 10 to 15 years before the retirement, maybe around 45 to, just before the retirement, they used to get diabetes. But the current generation, what we are seeing is, it is much earlier. Like we have discussed earlier, it is even at the as young as 15 to 20 years, what we are talking, the type 2 diabetes, which is more related with our lifestyle factors. Okay, so it is not the genetic diabetes or the type 1 diabetes which we are talking. It is the type 2, which is the commonest one, which we thought that it was, it was prevalent in the old age people. Now we are seeing in the youngsters, yes, like we all have discussed, the lifestyle factors are contributing a lot to it. Okay, so our shopping preferences, eating preferences, all are contributing to it. Yes, 1 out of 5 patients diagnosed with diabetes is less than 35 years, and it is not shocking to me if that numbers increase in the near future as well.
All right. So you also have sort of sounded those alarm bells. All those people that are watching out there should, take note of this. Dr. Joseph, help us understand when the sugar is high. What are some of the things that we need to keep a lookout for? What are some signs and symptoms and signals that the body is trying to tell us, but maybe we're just ill aware or are uneducated as to read what those signs are telling us?
Yeah, I think it's a very important and probably a key question to understand when things are actually going off the rails, as it were. So one of the key things with the symptoms for diabetes is that they are very non-specific, and if you don't have both your eyes and ears open, you might just mistake it for something that is in passing, or you might get confused with regards to it. So the key symptoms when your blood sugars are on the higher side, essentially you're likely to feel tired. You might be passing a bit more urine than usual. Some people suddenly lose a lot of weight. Some people find that they're finding it difficult to concentrate. Some people might have a blurring of their eyes. So there are a number of symptoms that can kind of point you in the direction of the fact that your blood sugars are not right. But this is very important to recognize that when your blood sugars are not that high, but still within the range for diabetes, you might not have any symptoms at all. So it's also important to also recognize that if your family is at a high risk of developing diabetes, maybe your dad and mom are diabetic,
Right.
your brother's diabetic, you yourself are having a bad lifestyle in terms of not having much exercise, eating junk foods, and your weight's on the higher side, then don't wait for these symptoms also. And the key thing is that don't discard these symptoms as innocuous or nothing to be worried about. And the test itself is very simple, as previously alluded to. It takes hardly a minute to find out whether you're diabetic or not. So go and have the test and make sure that you are detected, because unless you find there's a problem, you're not going to be able to deal with it.
All right. Dr. Joseph, we also have that question from, Shubhu, who's joining us from Mumbai. Let me take that question to you as well. It says, how does diabetes affect the heart, eyes, kidneys, and the nerves? Shubhu, your question. Dr. Joseph, would you like to take that one?
Yeah. So one of the problems with diabetes, as I alluded to, is that it's difficult to actually detect it. But even once it's detected, you can go for years being an uncontrolled diabetic and having very few symptoms, because it's a kind of a silent killer. And essentially, to put it in very simple layman terms, the high glucose actually affects the lining of the blood vessels it could be the heart, it could be the eyes. You could have blood vessels to the brain, blood vessels to the feet. So it has multiple effects on the blood vessels and the nerves, affecting all of them fairly adversely. And over a period of time, you can have, top to bottom of your body involved, essentially. You can have your eyes involved, you can have bleeding into your eyes. One of the biggest causes of blindness in the developed world is essentially diabetes-related eye disease. You can have your heart affected. It dramatically increases your risk of having heart attacks and other cardiac problems. It affects your kidneys. Everybody knows about the fact that one of the leading causes of kidney failure, dialysis, need for transplantation is the fact that you have uncontrolled diabetes. When it affects the bloods and the blood supply and the nerves to the legs, you can have lack of sensations leading on to ulcers, and if it's not well treated, you can go all the way up to amputation. So it's not to scare people around here, but I think it's
But you are
important
scaring me, doctor. You certainly have done the job scaring me.
Yeah, but please don't. I mean, there's always help around the corner. All we need to understand is that you need to take this adversary very seriously and fight with him with all the information that we have, and you can overcome it.
All right. Dr. Farishta, I have a personal question to ask as well. And I'd like you to be honest, if you can draw a comparative. Is sugar worse than smoking? I mean, a lot of youngsters out there, they do partake in sometimes recreational smoking. Some are even addicted. So what would you say upon that? Is sugar as bad as smoking, worse than that? Or, I mean, where do you stand on that comparison?
See, if you ask me as a doctor, I think both are bad. So I definitely both are bad. And then if I have to take the more bad, then of course it is diabetes, it is sugar. See, it is like ये दीमक है, ये आपके सर से लेके पैर तक. So it is gonna eat everything. It's not gonna leave anything, to make it very, very simple. So definitely, if you are smoking, still you are at risk of developing probably a cardiac or a lung disease. Sometimes you may affect the peripheral vascular disease, your blood vessels in the lower limb. But if you have diabetes, right from your eyes to your foot, हर चीज affect होती है, ये एक दीमक है.
But like people love their chocolates, people love their chais, people love their jalebis, and everybody's got a vice. Indians love their food. You can't keep them away from it. So let me ask you also, doctor, what's your sweet sin? Do you still allow yourself a little bit of sweet here and there, or do you have a magic mantra that works for you?
See, we all are human beings. Let me tell you. And then as Indians, we are known for feasting and fasting. I think that is what defines us. Any festival, you name it, and then without sweets to celebrate kya kiya. But definitely, I think all of us are into it. It is the limited quantity and then the type of sweet. So it is always advisable to avoid the processed sugars and all, because that is definitely a risk. That is a serious bad no. You can probably, I'm not saying for diabetes patients, I'm saying for healthier, normal patients, for normal public. So if you have two options, say probably a jaggery or sugar, a processed sugar, yeah, then probably a jaggery, maybe a sweet out of jaggery would be a little better than a processed white sugar. So processed white sugar, certainly I think all of us have to avoid.
All right, all right. Dr. Sundar, let me throw the buck to you. Let's come back to the educational aspect of it all. What test essentially matters the most for diabetes? I have some people, who are suffering from diabetes back at home. I hear them say, fasting blood sugar is one particular blood test that essentially happens. But what's the most important one? What are different types of testing? And what should the youngsters keep their lookout for and keep their focus on?
Yes. So regarding the tests, there are two types. One is the screening test to identify a person who doesn't have diabetes. There, this fasting blood sugar, the HbA1c, or the postprandial blood sugar, like after giving 75 grams of glucose, we identify what is the sugar values or the glucose values after 2 hours. So these are the three tests which are recommended by the standard guidelines like the RSSDI guidelines or the American Diabetes Association guidelines for diagnosing diabetes. Suppose, like as you told, some person already has diabetes, then there are a couple of tests which have to be, remembered by the patient. One is the regular monitoring at home. Suppose some person is taking insulin or some other medications which can cause low sugars. We ideally advise them monitor at least, ideally it would be daily monitoring, but at least once in a while based on the patient's condition, they have to monitor their glucose using a finger prick method, or maybe a continuous glucose monitor option is also there. So this is for the home monitoring of blood glucose. Suppose someone goes to the lab. So there are different set of tests. What test you have to do once in 3 months, what test you have to do once in 6 months, and what tests you have to do at least once in a year. So if we go into what tests you should do once in 3 months, it is yes, the fasting blood sugar, postprandial blood sugar, and the HbA1c, the 3 months average sugar which we get, the glycosylated hemoglobin, that you have to do. Along with probably once in 6 months, your doctor will ask you to get a urine microalbumin creatinine ratio, where they would like to look into whether there is some proteins being leaking in your urine. And now when we come to what are the tests that should be done mandatorily at least once in a year, then yes, your retinopathy screening, that is, they want to look into the nerves within the eyes, whether there is some changes because of the diabetes, along with your HbA1c, along with your urine microalbumin creatinine ratio, along with your creatinine, and maybe lipid profile if indicated, and liver function test is if indicated. So, and with every visit, your doctor will look at your foot, which is very important. And most importantly, what I tell to my patients is, like when you wake up in the morning, see, we all see in Hindus especially. So when you wake up in the morning, you see your eyes and you say, Karagre vasate Lakshmi, Karamadhye Saraswati, Karamule sthite Gauri, Prabhate Karadarshan. What I tell is, while you're going to your bed, look at your feet, because when there is loss of sensation, there might be some cuts or there might be some injuries which are not noticed. So you should look at your feet before going to your bed, especially for people who have lost the senses. So these are the, some tests, glucose monitoring, foot examination done by the patient at home, some lab tests which are advised by the doctor. These all have to be kept in mind.
Many thanks, doctor, for not just educating me, but all the people out there. And it seems like Utkarsh from Delhi has a question for the doctors here as well. Utkarsh, can you hear us? Aap hame sun sakte hain? Who would you like to direct this question towards? Yeah, take it away.
Yes, you are audible, Kabir. Actually, I had a question. I have a history of a family diabetes. My mother, my father, they both are diabetics. So I just want to ask, is there any, danger for me to get diabetes, to get attracted towards it, or are there any precautions or cautions that I can take to avoid it?
Yeah, I mean, I think you are predisposed to that. I don't need a degree to tell you that, but maybe the doctors can help us understand what are some of the precautions that, Utkarsh here can take. Dr. Joseph, would you like to take this question?
Yeah, so I think the fact that your family has a strong family history of diabetes means that you are at a higher risk than somebody who doesn't have that family history. I think that's very obvious to all concerned. Now, what can you do to actually reduce your risk? I mean, all the studies that we are aware of tell us that the most important way in which you can prevent occurrence of diabetes, if you're predisposed to it, is by maintaining a healthy weight and having a focused diet and good exercise. So the diabetes prevention program, or the DPP study, which is one of the seminal studies which was done, showed that if you are able to put into practice at least 150 minutes of exercise a week, moderate intensity exercises a week, make sure that you can restrict your calories and not have highly refined sugars and processed foods and ultra processed stuff and highly sugary stuff. And make sure that you are exercising well and you're having enough sleep and you have control over your stress levels. All of these are things that you can do for yourself and help prevent the occurrence of diabetes, even if you are genetically predisposed to that by virtue of the fact that your parents or your close relatives are diabetic. So the key things are proper diet, at least 150 minutes of exercises a week, which means at least 20 to 30 minutes a day. That's what you should be aiming for. Good sleep, at least 6 to 8 hours. Make sure that you avoid unnecessary stress and have some time for relaxation, yoga, meditation, and all the rest of it. So it's not just about pills and potions. It's about making sure that the key 5 ingredients in life are set so that you can reduce your chances of developing diabetes.
To know here is, sir, what part stress plays in diabetes? Does it affect diabetes to, grow more and more prone?
Yeah, absolutely. I mean, if you are extremely stressed, that actually leads to release of hormones in your body, which actually, counteract the effects of insulin and makes it more difficult for insulin to work. So the fact that you are chronically stressed because of your job, or the fact that you don't have relaxation and all the rest of it, is going to adversely affect your sugars. We see this all the time in our clinics, that if somebody has gone through, say, a recent bereavement, and somebody close to them has passed away or something, and they are under stress, they come back with their usual control. Suddenly it's all gone to pots, as it were. So stress does affect it. Lack of sleep affects it. If you have shifting patterns of sleep, that also badly affects your diabetes, as you can see with nighttime workers and people who keep having shift working and all the rest of it, because it kind of disrupts your rhythm of your hormones, as it were, or the circadian rhythm, as it were, and that actually plays a large role in actually making your diabetes more difficult to control, and also makes you less focused on the diabetes because you're stressed and you're dealing with other things, and that also probably plays into it.
Well, from what I understand, it has to be a smoothly functioning orchestra where even one single bad instrument is going to make the entire setup look and sound bad. And, it's easier said than done, doctor, to say that, we should avoid unnecessary stress. For me to now compare and differentiate between what is the necessary stress and what is an unnecessary stress is in itself so stressful. So, it's easier said than done all the time. Dr. Farishta, you earlier told us about a great swapping technique about instead of processed white sugar, you go for jaggery. That seems to be the right substitute and alternative. What are some other simple food swaps that Indians can partake in, the youngsters out there can partake in? And it's going to be a difficult job because you have to substitute the burgers, the pizzas, you have to substitute all the new trendy things that are quick to make, easy to access, and needless to say, very, very harmful for you.
So definitely, I think we all have been advocating this, that your plate should look colorful. So when we say colorful, it is not that you take a colorful plate. When we say it has to be colorful, it has to have adequate amounts of fruits, vegetables, some curry, and then some portion of it, with rice. So when we talk about swapping of food, I think I would here take a moment and read the labels of your food. I think this is where, as Indians, we are lacking, and that is the price we are paying for. Start reading the labels. I think that
What
will
should
make
we
you
keeping a
much
lookout for,
more
doctor?
wise.
What should we look out for? I know that it's called sodium, it has potassium, it has all those breakups behind. What should be focusing on? Just sugar, or is there other aspects to look at as well?
So I think to make it very simple, look for sugar, look for maida. I think that is one big culprit. If I have to label three whites which are destroying all of us, it is sugar, salt, and maida. So these three whites is where you have to look for in all your labels. So I tell my patients, basically just look for these three whites, see if it is in a higher quantity, or it is always better to avoid these, maybe, or you take it in the permissible quantity. I will not start talking on that, it will go in length, but take it in a permissible quantity, what is advised by your doctors, and start reading the labels. I think that will make you more wise. Take something which is high in protein, probably low in sugar, and gives you some energy as well. So when we talk about sugar, let me tell you, carb in limited quantity is very much required. It is required for your brain to function. It is required for you to function. So definitely carbohydrate is required, but in the limited quantity.
All right. Limitation, balancing act. I think that's where things get tricky. It's a balancing act. You need to keep a nice fiddle on that. All right. I'm being told Arun is another caller who joins us on the webinar to ask that question. Arun, can you hear us? आप हमें सुन सकते हैं?
Yes, Kabir, I can hear you. Am I audible?
Yes, you absolutely are. Take it away. What's your question, Arun?
Thank you so much for taking my question. I just wanted to ask, can intermittent fasting help diabetes patients, or is there other way around?
Intermittent fasting. Today, doctors, so much of our protein is also consumed through attas, through so many snacks. This is all food fashion. That's also, marketing does a number on you, doesn't it? So intermittent fasting, I know it's an ancient technique, but it has been marketed by so many of these, upcoming, health platforms. One can't really trust it completely. And can one trust something that they don't truly understand? Dr. Sundar, would you like to take that question? Intermittent fasting and its impact on diabetes and how we tackle it?
Yes. So yes, regarding intermittent fasting, the studies they have done, and it has shown like you reduce your calorie intake and reduce your time of intake. Okay, maybe 8 hours in a day you are consuming your food, and another 16 hours you are not consuming anything, 16 hours or 14 hours, depending on your individual preferences. So this is what intermittent fasting is. And here, what we should remember is consistency is the key. Okay, so whatever you are doing, whether you are fasting for 12 hours, whether you are fasting for 14 hours, or whether you are fasting for 16 hours, based on individuals' preferences. So what are the things we should keep in mind while suggesting intermittent fasting is, so some patients, they are prone to migraine headaches when they are, fasting for a longer period of time. Okay, and some people who are on insulin, we do not suggest, fast for a longer period of time where there is some starvation ketosis happening and all. So based on the individual's perspective, their body weight and their body composition and what they can follow. So if you are doing intermittent fasting, do it on a regular basis. Not like हफ्ते में एक दिन मैं 16 घंटे कुछ नहीं खाया and the next day मतलब दबा के previous days का भी मिला के खा लिया, then it doesn't work that way. Okay, so whether you are doing intermittent fasting or not doing intermittent fasting, calorie restriction is important. ठीक है, तो आपने खाना है तो your plate should contain very small portion of carbohydrates, like Dr. Farishta said, and include more vegetables and proteins. Have a balanced diet that is much more easier to follow in the long run. Okay? This is not a short distance running where you run for 100 meters and khatam ho gaya. This is a long run. It is a relay. It is like a marathon which needs to go on. Yes, so you have to be prepared for it. And in marathon, it's not like acute sprinting doesn't happen. You should be consistent and you should be carrying it forward. That definitely helps. but again,
right.
under the guidance of your doctor.
All right, Arun, I hope that answers your question. It seems like the operative part here is that consistency happens to be the key. All right, Abhishek joins us from Meerut is what I'm being told. Abhishek, can you hear us? अपना सवाल प्लीज आप डॉक्टर्स से डायरेक्टली पूछ सकते हैं.
Yes, sir. I have a question. Some people have always their HbA1c levels are always controlled, but their fasting sugar is always high. So, sir, what is the reason behind that?
Interesting question. Dr. Farishta, Dr. Joseph, any one of you would like to take that if you got that question? H1, A, B, C, I don't know the exact nomenclature for that. Those seem to be fine, but the fasting blood sugars are always high. What seems to be the reason for that? And is that an underlying sign, symptom, something that, Abhishek can understand or help his family members understand?
Okay, I think Dr. Joseph was about to take it. Please,
No.
Go ahead, sir.
No, that's fine. I mean, I think it's a very good question. I think the key to understand is that the fasting blood sugar, to a large extent, is the glucose that is being poured out by your liver. And the glucose is actually being synthesized from the liver, and the liver becomes, when there's a lot of fat in the liver becomes increasingly resistant to the action of insulin. And so overnight, the insulin doesn't work that well, and therefore you can have high blood sugars or higher blood sugars in the morning. But overall, I think you can be reasonably happy that if your HbA1c is quite well controlled by around 6.5% or less, then you can be reassured that that by itself, just having a fasting blood sugar which is slightly on the higher side, by itself shouldn't make you despondent that your diabetes is not under control, because the rest of the day is also as equally important. There can also be situations where you're on some kind of treatment where you might be having low blood sugars through the night, which you are not being aware of, and that can actually cause your fasting blood sugars to be higher in the morning. So say if you're having low blood sugars at 1 a.m. or 2 a.m. in the morning and you're not really aware of it because you're sleeping, your body will counteract the fact that your blood sugars are going low. So you may wake up at 6 a.m. in the morning and check and find your fasting blood sugars to be on the higher side. But you have actually missed the fact that you had low blood sugars through the night, which were not picked up. So there can be any number of reasons why your fasting blood sugars might be on the higher side. So if your HbA1c is very well controlled and you're having fasting blood sugars which are on the higher side and which are concerning, then the best way to use to find out more is to use technology. And what we have now is something called continuous glucose monitoring, which is a small device the size of a 1 rupee coin that you can fit onto your arm. And it measures your blood sugar every minute, so to speak, and sends it to an app that is connected to your phone.
Yeah.
And you can look at it at any time and find out what exactly your blood sugars are doing on a minute-to-minute basis. And you can see for yourself what is the pattern of your sugar control, as it were, and then decide whether this is just a red herring or something that's more important that needs to be dealt with, either in terms of changes in your diet, changes in your lifestyle, or changes in your treatment.
Dr. Joseph, you have put it so eloquently. Many thanks for that. I do see a lot of my colleagues as well, with that new technology where their blood sugar is being monitored constantly. I hope that answers Abhishek's question as well. But I don't know whether to be worried about how so many other people are making use of this tech, or be happy for the fact that now technology is leading people to understand and better understand their bodies. But, some final questions before we wrap this up. Dr. Farishta, let me come to you. Since you very graciously let Dr. Joseph answer this question. Dr. Farishta, can we reverse diabetes? Is that possible? Is that a myth? Help the people understand, because like I said right in my introduction, for a lot of people out there who aren't going through this or haven't seen serious diabetes cases in their families, they think it's as simple as zyada meetha nahi khana hai and things are going to be okay. But that's not the entire truth. So can diabetes be reversed?
Before I take that, ज़्यादा मीठा नहीं खाना है. One question I think my colleagues also will agree with this is, sugar खाने से diabetes नहीं आती. I think this is where people, when they come to you, they say कि ये sugar ज़्यादा खाते हैं, इससे sugar आ गई. So you try to understand that if that was the case, then all of us would have been diabetic till date.
Yep.
So one myth we all have to understand. And then there is something called as remission. So I think remission is the right word, where now there was research which was done and it is published in the NEGM, that is in UK, that if you have a weight reduction of around 10%, so say if you are weighing 100 kgs and if you get your weight around say 85 to 90, then you may go into remission. So remission is that phase where you're off your tablets, you're just doing a good physical activity and diet, and your sugar is not getting on the higher side, and then it keeps going on that way. So remission is the right word. I think all of us agree with that, that yes, a remission can happen with weight reduction in patients who are obese, who have a very high BMI, maybe more than 30. That is where it is possible. Reversal is, I think, very wrongly used by, I would say, misinformation, very wrongly used by people. So do not get, carried away by reversal. It could be remission. That also under, if you have a doctor who is advising you for the same.
All right. We have some more questions. I'm going to quickly take these, from Dr. Shyam Sundar. Dr. Sundar, help the viewers understand. This is a question that's come across from Tushar. And, youngsters would want to know about this very quickly, running out of time here. Can diabetes cause sexual health problems as well? Let's focus on that as well.
Yes. So coming to the sexual health, male sexual health and the female sexual health, दोनों बात करेंगे.
जी.
So male sexual health, long-standing diabetes, uncontrolled diabetes, like it was discussed in the earlier panel, it can affect any organ from head to toe because it is affecting your blood vessels. Okay. And we all know that because it is affecting the blood vessels, it can cause erectile dysfunction in males. Okay, so many of the people with long-standing diabetes, they do come with the complaints of erectile dysfunction. Unka testosterone levels normal hai, everything is good, but they are facing this problem. This is because of the inflammation which is happening within the blood vessels. Okay. And second thing is the genital infections. Okay. So ये fungal infection जो होता है, melanocystitis can happen in males. Okay, when there is uncontrolled diabetes and certain class of medications which throw out the excess glucose in the urine. Okay, so when the patient is not aware that they are using these medications, they are not maintaining proper genital hygiene. So there can be this melanocystitis or the fungal infection of the glans penis. And coming to females maybe there can be fungal infections. Okay. And next thing is even some amount of dysfunction because of the long-standing diabetes and the mental issues which is causing it. So there can be sexual dysfunction in females as well. Okay, so though no, it is not very much addressed or spoken about in the common forum, like the attention what erectile dysfunction receives, the female sexual dysfunction also, it is very much underreported, but yes, it is possible with a long-standing.
Many thanks for highlighting that, doctor. Many thanks for highlighting that.
Yes.
All right. I think this has been a riveting conversation so far. You are all busy gentlemen. I do know that. I think we're going to leave it here. The message is clear. समझदार बनो, सेहत के इशारे समझो. Diabetes is not going to wait. Neither should you. So get yourself tested. Start taking action. And many thanks to all the doctors, Dr. Shyam Sundar, Dr. Jeevan Joseph, and Dr. Farishta for answering the people's questions, educating me, educating the larger audience out here. And of course, many thanks for joining us here on this special TV9 समझदार बनो सेहत के इशारे समझो initiative. Many thanks, doctors, for taking out the time. Get tested, get yourselves taking action and control over your health care, because sweetness in life works, but sweetness in your bloodstream, that certainly is going to work, at least not in the long run. Many thanks for watching.